I think this is an excellent educational meeting. We have very top people here teaching and a very sophisticated audience of people that are skilled at practice in rheumatology, pediatrics, nephrology, and general internal medicine. So it shows that we can reach a wider community of physicians who are responsible for giving advice to lupus patients. I think that a meeting that has variety is very good and it helps learning, so that when the people who are attending can interact positively with people who are teaching and with their colleagues and can discuss interesting cases and problems that have arisen, the differences in treatment between practices in different countries and different sections of the world. We all enjoy it, and we all learn a lot from each other. And then it's nice to just sit back and let an expert give you a 30-minute, 45-minute lecture on the cutting edge of what exactly up to date therapy is, and theory and basic science. So this is a very nice mixture. I also like the breaks and the meals, which also give you a chance to sit with somebody you haven't met before and find out how they do things. So it's tremendously enriching to have people from multiple countries with different specialties who are all interested in lupus come together to talk about it. Well, the first mission, I think, is educational, and that would be that we make lupus a disease that comes to everybody's mind when you're working with patients who have symptoms in your clinic or your office or wherever you're working. So lupus comes to mind and you're educated in lupus. So that's the first thing. The second thing is that there's a consortium that has resulted from work in the Lupus Academy that is looking at how we would treat to target, which will become, I hope, a big buzzword for approaching lupus in the next decade. As in rheumatoid, a physician should treat a patient to a target of much less active disease. We will establish the same approach in lupus, and it will become required for quality care in all countries. So there's already a consortium working on what that definition would be with, I think, 14 centers in 10 countries was what they said last night, and that grows directly out of the Lupus Academy. I'd like to see a lot more of that, and as the Academy has expanded to involve more of the world, we should be able to get very effective working groups for this type of thing.